You may have heard the healthcare system in America has issues. Issues of affordability, issues of access. But you may not have heard it also has issues of diversity. 1 out of every 4 Americans belongs to a minority group. Yet, out of every 100 healthcare workers, only 9 are minorities. Given the trend over the last 30 years, the numbers will only get worse, unless something is done. Here is what one group is doing.
And we're going to be focusing on academic achievement, application process, and the skills that you need to make yourself as successful as possible in the medical field.
Is there a noticeable difference between patient to patient? And probably not from patient to patient. But when you look at large numbers, which is what we're dealing with in public health, it's not just the individual patient, but it's the entire patient population. When you look at the entire patient population, that's when you start to see the differences in care start to play out. So on a one-to-one, comparing apples to apples, you may not see the differences, but on a larger scale, when you look at aggregates of patients, is when you start to see the differences in care.
Having a diversified workforce, admittedly, is not going to affect every patient. It's not going to be the solution for every problem. It's not going to fix all disparities. But there is definitely data that's been shown in multiple studies that shows that some patients appreciate their minority providers better. They feel that they communicate with them better. They feel that they trust them better. They feel that they believe in the medical plans that the providers prescribe. And so therefore, this is just one step in the right direction.
It's a step in a journey that started when the Sullivan Commission released a report entitled Missing Persons, Minorities in Health Professions. In the report, the Commission found, quote, cultural differences, a lack of access to health care, combined with high rates of poverty and unemployment, contribute to the substantial ethnic and racial disparities in health status and health outcomes, end quote. In other words, the health needs of minorities and the poor in general are not being addressed.
In minority populations, we see that outcomes are worse than in your majority populations. Things like hypertension, diabetes, asthma, obesity, those types of things tend to affect minority populations in a worse way. And so by bringing more diversity to medicine, what we see is that our outcomes for these populations will actually be better, and so we'll have a healthier society. So that's why it's absolutely necessary.
Thank you for welcoming us to our last stop on the Tour for Diversity in Medicine. So Cameron and I actually met through another organization, and one evening after a board meeting we were sitting around and we were discussing what we can do to encourage students to go into the health professions and get them from point A to point B.
We realized that there was a need to reach out to students on their own home turf. So therefore, we created the Tour for Diversity in Medicine to use an old method of college tours on a bus and visit schools and bring our advice, our mentoring, our experiences to them.
The tour rolled through 5 HBCUs, historically black colleges and universities, in 5 days. First stop, Hampton University in Virginia, home of the Emancipation Oak, and where Booker T. Washington studied. Then on to Johnson C. Smith University, a founding member in the United Negro College Fund. From there, it was on to Orangeburg, South Carolina, and South Carolina State College, the first state-funded HBCU in the country, done mainly to preserve the separate but equal laws at the time. Next, Tuskegee University, whose first principal was 25-year-old Booker T. Washington, and was made famous by their airmen. Last stop was Jackson State University, founded in 1877 as a seminary with an initial graduating class of 12. Jackson State now holds the designation of the urban university of the state of Mississippi.
We wanted to choose places that were on the cusp, places that had enough to make it worthwhile for us to come, but also they recognized that they still had a need and recognized that our contributions to them would be helpful.
We couldn't afford to pay for this. And I don't think that you understand that you're starting an earthquake. You're starting the kind of movement that we've needed for quite a while now.
So since the loss of electrons, the number should be going down, not up. So that means I'm going to eliminate C, and B is going to be my answer.
So the group of mentors that we have along with us, the 9 individuals, 3 physicians in addition to the co-directors, 4 medical students, 1 dentist, and 1 pre-health advisor, are diverse in and of themselves. This allows our team to offer the widest range of experiences and mentoring and advice so that the students can see, I can apply to medical school, I can graduate from medical school, and I can practice medicine.
What other HBCU would you go to if you didn't have the opportunity to go to yours?
So I heard about the Tour for Diversity from Dr. Alden Landry. He's definitely one of my mentors. He dropped the idea on me that he was working on it. So when he actually presented me with the application, I decided to sign up, and now I'm here.
Being able to travel through the South and being able to bring the information about the application process, what students need to be doing. As soon as you step foot on that medical school, like you're being evaluated, so just be friendly, courteous, respectful to everybody who you interact with. It took me a long time to get the mentors that I needed, to actually get the information of what I needed to do, when I should be doing it, and I think the earlier that we can reach students, the better.
You have the body, you have the transverse process, you have the spinous process. One of my passions is to increase the enrollment of minority males into medicine. There's been multiple times throughout my career that I've been either the only male or the only minority male in several situations, including with medical school. There was only 4 minority males out of a class of 120.
As long as you're prepared and as long as you're doing what you need to do, taking those small steps, you are very, very likely to be able to get into the schools that you, or the profession that you're interested in.
Healthcare is a very one-on-one service. So when I look at it, and my journey in health professions has been to treat each patient as an individual, as a human being. I think the issue with diversity comes into play more so with having healthcare providers who are interested in practicing in those communities that are traditionally not served by healthcare professions.
Repeat after me. I have a story.
I have a story.
You want to hear my story.
You want to hear my story.
Say that same thing and put it in the air.
The gritty truth is that there are patients who have lived their lives being marginalized. And so they anticipate that same experience when they enter the healthcare system.
You have a story.
You have a story.
And we need to hear your story.
And we need to hear your story.
All right, have a seat.
It's important when you're looking at a patient to have some understanding of what about that patient's personality, what about their cultural influences, what about their ethnicity affects their health, because all of those are what we call determinants of health.
There are other ways you can finish the PhD and then go to medical school.
To make a difference in, I think, how you perceive certain things. I think that's where the difference comes in terms of having a diverse medical population, being able to understand a background from a patient, being able to understand the circumstances, I think makes that much more sense, or makes it mean that much more to my patients if I understand where they're coming from.
How many of you think you have to choose what you need to be before you go into med school? Healthcare is not a privilege, it is an absolute human right. And so whatever your color, whatever your ethnicity, whatever your socioeconomic background, you deserve the best care possible.
Just because you're scared, you can do it. It really does help that I went to an HBCU undergrad, so I did have the same experiences that they had, and the fact that I had to take my MCAT twice, they're like, oh my gosh, it's not unusual, it's normal. It's not normal, but it's okay if I have to take my MCAT twice. And if I do, you know what, I can still become a physician. I don't have to give up on my dream.
My name is Francisco Castellan, and I'm a health professional advisor at Northwestern University.
I'm part of an association for advisors on a national level, so that it's called the NAHP, National Association for Advisors in the Health Professions. The advisor has a bigger role than just writing a letter of recommendation. And again, making sure that they're in tune and they have a pulse on all the different health professional programs so that they can help that student make the best decision on which one's the best match.
I'm a major in the United States Army stationed at Fort Benning, Georgia.
Corporate America should be interested because every individual in corporate America needs a good physician.
It's important for corporate America to care because it impacts everybody. It impacts, the whole country, and so by getting involved with this, we're helping not only, the students, we're also helping everyone get, treated adequately when they have medical, issues and needs.
every year of service or every year of scholarship, you owe a year of service to the military.
This tour, for me, is so important because it gives a face to some of the aspiring young physicians that, that they can pursue their goals.
Speaking of goals, what about the goals for the tour? If one judges solely by the press it received, it would be considered a success. But what about at ground level? Well, connections were made, knowledge was gained, and dreams were ignited.
A lot of times you hear about medical school and the tax, or it seems so daunting. But when you actually talk to people who've made it through who are in school, they're not too far from you.
Mentoring to it because there's not many professors here that are willing to do that role.
There's been a lot of hints given out. There's been a lot of insights that I wouldn't know beforehand prior to getting into this.
This is a once-in-a-lifetime experience.
This week filled so many of my dreams in terms of the personal connections that I got with students across all 5 states. Just the comments that they gave, the questions that they asked, just kind of the light that we saw in their eyes in terms of, I can really do this. And that was what we wanted out of this. And to see that every day was just overwhelming.